In the South Valley, financial issues continue at Kaweah Health in Visalia. The hospital's CEO says their money problems have gotten so serious that they're starting to turn away Medi-Cal patients who are looking to receive elective surgeries and procedures. CBS 47's Catherine Phillips shows us what else the hospital system is doing to keep the South Valley.
The hospital already laid off hundreds of staff members late last year, but they say that's not enough. They say unless something changes with the payout from Medi-Cal, they'll only continue to lose money.
3 years into the COVID-19 pandemic, Kaweah Health CEO Gary Herbst says the aftermath is proving to be even more dire to the hospital's bottom line.
We used to be a pretty healthy, about 150 days cash on hand, approaching 300 million. And we are now down to 76 days at January 31st.
He says the issues started in 2020 when the state began pausing elective surgeries during the height of the pandemic. He says in April 2020 alone, they lost $12 million. That number now up to $136 million. He says the main issue now isn't just because of COVID.
We haven't received an increase in our Medi-Cal outpatient reimbursement rates for 30 years, despite the cost of healthcare going up exponentially.
He says they lose money every time they treat a patient with Medi-Cal, saying the repayment rate from the government only covers 75% of the cost. An issue only heightened by the fact Tulare County has the highest percentage of Medi-Cal recipients statewide. Herbst says they're watching other hospitals close across the state, including the North Valley's Madera Community Hospital.
We're not going to file bankruptcy. That's not going to happen here. And we're probably better able to weather this storm, but it's not come without, gut-wrenching, heart-wrenching actions, like laying off hundreds of employees.
In November, the hospital announced they were going to pause raises, cut executives' pay, and lay off over 100 employees. Now they're turning away Medi-Cal patients from elective surgeries, saying they can't keep absorbing the losses.
We do take care of our entire population, but unfortunately, we're going to have to start restricting care to that Medi-Cal population.
The CEO also spoke to the Tulare County Board of Supervisors about how they could support the hospital. He says an idea would be a sales tax in Visalia or a parcel tax in the county. Reporting in the studio, Catherine Phillips, CBS 47 Eyewitness News.